Cervical cancer, in contrast to some other cancers, is primarily a disease of younger women. The peak incidence is in the 30s, 40s, and early 50s. The risk factors for cervical cancer relate to exposure to a particular virus called human papillomavirus. Although it should be noted that HPV, though it is a sexually transmitted virus, is pretty ubiquitous. It is everywhere, and that 80% of women who have ever had sex have been exposed to HPV. So most women, their immune system detects the presence of the virus, clears the virus, and they have no infection, no problems, no long-term issues whatsoever. For reasons we don't entirely understand in many cases, there are some women who just don't fight off that virus effectively. Lifestyle modifications that can help reduce the risk of cervical cancer include not smoking, or if you do smoke, smoking cessation. They include the use of condoms with new sexual contacts, and adequate screening. Current screening recommendations for cervical cancer have changed in recent years. We used to recommend screening at age 18. We have pushed that to age 21, so women 21 and over should be universally screened. Screening is with a form of a pap smear every 3 years intervals from age 21 to age 35, and at 3 to 5 year intervals thereafter, provided normal results. Additionally, we recommend at this point that before sexual debut, in other words, the first intercourse, that young girls are offered HPV vaccination with consultation with their parents and pediatricians. The HPV vaccine is effective against two of the most oncogenic types of HPV, two of the types that are most likely to evolve into cancer. And vaccination will prevent probably up to about 60% of cervical cancers, with relatively few side effects from the vaccination itself.